A 60-year male presents with complaints of swelling at left lateral side of lower limb below knee joint. He has no complaint of pain or localized tenderness, but there is watery discharge. Here we see the skin, subcutaneous tissue, muscle layer, and cortex of bone, which appears echogenic. Here we see the hypertrophy of subcutaneous tissue with some hypoechoic areas. The subcutaneous soft tissues are less echogenic, but no mass or lesion seen. These hypoechoic areas are ill-defined or looks like a fluid collection in the soft tissues. The fluid is anechoic, no debris seen. Here we see the fluid collection in the subcutaneous tissues layers. Below this, we see the muscle tissues are normal and no mass lesion seen. Now, if we continue scanning the fluid in the soft tissues towards knee joint, we see the fluid is continuous in the subcutaneous tissues as irregular track. Here we see the fluid track is continuous to the knee joint. This is the proximal head of tibial bone, and this is distal head of the femur bone. And we see the track of fluid continuous between the knee joint. Here we see the minimal fluid collection also present in the subcutaneous tissue around the lateral side of the knee joint. It means the synovial fluid is leaking from the knee joint and continues down to the upper part of the right lateral side of subcutaneous tissue of lower limb. Now when we flex the knee joint, here we see the head of femur and head of tibial bone, and there is a hypoechoic or ill-defined area right lateral side of the knee joint and joint effusion present. Now on color Doppler, we see no flow in this hypertrophied area or cystic area. Now we will measure the hypertrophied area or affected cystic area of soft tissues. Approximately 8.8 into 46.9 millimeter of subcutaneous tissues are affected or hypertrophied. Now how we will write report. The subcutaneous soft tissues are increased in size, measuring 46.9 into 8.8 millimeter and shows heterogeneous texture with cystic areas present at the lateral side of proximal part of left lower limb. No soft tissue edema or mass or lesion present. Below the area, the muscle layers are normal. A streak of anaqueous fluid present between the muscles and subcutaneous layers, which is continuous upward and ends to the lateral side of knee joint. The ultrasound diagnosis is left knee joint fistula and knee joint fluid is accumulating in the subcutaneous soft tissues of fatty layer causing hypertrophy.